Good morning.
Morning.
All right, we'll give it a couple more minutes for folks to trickle in.
Good morning, everyone.
Good morning.
Good morning.
Just going to give it one more minute, hopefully, so we can hit quorum.
Good morning, everyone.
Good morning. Okay, well, I don't think we've quite hit quorum, but I'll go ahead and call the meeting to order. Good morning, everybody. Actually, here we go. We're going to hit quorum. Looks like Renee is about to join on here. Perfect. Good morning, everybody. I'm Jonathan Crooms, the chair of the Performance Management Subcommittee. Welcome to our May meeting. We've got a pretty full agenda today, and a lot of what we will be talking about is some of the changes that have come and that will come with the retirement of Lloyd. To start things off, do we have anybody who wishes to make a public comment? Okay. No public comments. First item up for review will be the April 24 meeting minutes. Does anybody have any corrections that need to be made? All right, no corrections. I'm happy to entertain a motion for approval of the minutes.
This is Renee Vaughn. So moved, Mr. Chair.
Okay. I have a motion from Renee Vaughn to approve the April 24 minutes. Do we have a second?
This is Eliza.
Oh, I'm sorry.
Go ahead. You got it. Go ahead.
Good morning, Jonathan. This is Vegas Sweps, and I'd like to second that, please.
Okay, we have a second from Vegas Swepson. Any further discussion on the minutes? All right, let's vote in the chat box. Okay, minutes are approved. Thank you, everybody, and thank you, Shantae, again for being so diligent with our minute taking. Okay. Well, next item up, I'm going to talk a little bit about committee leadership and staffing transitions for the upcoming HSAC year. So we have a couple transitions here. First off, I wanted to let the Performance Management Subcommittee know that I will be stepping down as chair at the end of this HSAC cycle. And I've reached out to a couple folks so far to kind of gauge interests in and who might want to be chair for this committee going forward. And of course, we're in May, but one of the things that our chair Eliza and the executive committee have been working on is trying to do a little bit more to recruit new leaders, and also have it so that there's a little bit more of a smoother transition for leadership. So we do have time here, and if anyone is interested in doing that I have not spoken with, send me an email, and I'm happy to talk further, so you know what the responsibilities will be as well. So be thinking about that. The other major transition, of course, that we have is that Lloyd Schmeidler has retired, and he was, of course, our community development staff member support for the work of this committee. And now in his place, Anthony Henderson is going to be being our staff support person. So he and I have talked quite a bit this week, and what we want to do with this meeting is give him a chance to introduce himself. I know he's probably talked to quite a few of you folks, who, especially those that are COC projects and receipt of funding, and give him a chance for you all to get to know him. And he is also going to be given a presentation today that covers many of the topics that we have been wrestling with this spring. So hopefully, I'm hoping we'll have some good discussion today and follow up to some of those topics that we've talked about earlier this spring. So without further ado, I'm going to turn it over to Anthony so you can introduce yourself and then begin your presentation.
Thank you, Jonathan. Good morning, everyone. I have been with the city for about 9 or 10 months now, and I um, joined as in Lloyd's line of retirement. There were some activities and things that the team took on, and one of them was to get somebody in early so that we would have sufficient time to overlap. I'm not sure if it was completely sufficient, but because Lloyd's a wealth of resource. But I come to this continuum from the Miami-Dade continuum, which is uh, probably about 10 times larger than the Durham COC. My role in Miami was for a shelter called Chapman Partnership, and we had 800 beds in our shelter, and we represented 60% of the continuum of care. This is the other side of it for me, working for the lead agency, and I'm getting a chance to really learn a lot, and am grateful to those of you that I have had a chance to meet and work with directly already. And just know that we're going to keep coming and keep doing our best to make sure that we have our system running the way you all anticipate it to run, and to make sure that we um, are doing our best on behalf of our clients and those we serve. So, Jonathan, I hope that was okay. I don't know if you want me to go directly into the presentation from here.
Sure, that was great. I just wanted to give you a chance to share a little bit about your background, and yep, we can jump right into the presentation. So Anthony's presentation really is going to cover topics 5 through 8 on the agenda, and we can stop for questions as we go through each one. But go ahead, Anthony, I turn it over to you, and hopefully you should be able to share your presentation. If you can't, let me know and I'll pull it up.
All right. Hopefully you all can see it. Not sure what this is doing. Can you all see this okay?
Sure can.
Perfect. Okay. Thank you. So, just as a little bit of context, there were a lot of topics. There are 4 main topics in this presentation today. I have tried my best to explain each topic in a way that gives everybody a chance to kind of wrap their heads around what it is we're actually trying to do, but also without getting too deep in the weeds on any particular topic. So what you'll see here, if you have a more background, more detail, and we can talk more about it as we go through it. So there are 4 topics that we're going to be covering today. The Housing First evaluation results, and the performance evaluation results. And I'm going to kind of cover those together. And then we're going to talk a little bit about the unspent funds, and then where we are in the current collaborative application process. And you all have to forgive me, I have to cough a little here and there. All right, so we recently went through and completed 2 main evaluations, the Housing First evaluation and the COC performance evaluation for spring. I wanted to do a little summary of each of these in this way, just so that you can see the differences in them, the frequency, and the components that are evaluated in each one. So for Housing First, this is an annual evaluation that looks at how organizations are implementing Housing First in their projects. And the components that are associated with this evaluation are housing process and structure, a lot of information about services, philosophy, and array, and then team structure and HR. On the other side, we completed the COC performance evaluation. This is a twice annual evaluation that we do spring and fall. The spring evaluation is an opportunity for projects to know how they're faring, and gives the projects a chance to address any main concerns or to try to make some improvements where necessary. And then the fall evaluation is the one that we use to rank and score projects for the collaborative application. So what we look at in the performance evaluation is the performance measures, the system performance measures, whether or not the projects are serving the most high need and vulnerable clients, the efficiency of the projects, their use of HMIS in terms of data quality, timeliness, and accuracy, and then equity within the projects. All right. So we're going to go back to just the housing first approach. So in this process, under Lloyd's leadership, we formed 6 3-person teams with representatives from HSAC, COC membership, and staff. Lloyd had adapted a tool that was from Pathways Housing First Fidelity Scale and revised it to make sure that we could get good Housing First Fidelity scores. We participate as an evaluation team. We participated in 90-minute Housing First training with our technical assistance advisor from HUD. And Lloyd gave all of the evaluators an orientation to the tool and the timeline. And then following the evaluations, we have been providing feedback sessions, both with evaluators and with the projects themselves. The results of this evaluation is that we evaluated 9 programs. I think 5 are PSH and 4 are RRH. There was an average score of about 66% out of 100. There was one outlier that scored at 96%. The remaining projects scored somewhere in the neighborhood of 48 to 72%. The lowest scores and the most room for improvement dealt with the service requirements, the support provided by projects, and the connections to community resources. And we saw this almost across the board, with the exception of the outlier, that the projects could really use a bit of boost in service provision, either formal or informal linkages to programs, or the requirements that are the requirements and restrictions that are in place. For example, in these sections in the evaluation tool, we look at, are clients required to meet with case managers? Or is there a frequency? Do they have to have a lot of restrictions? Do they have to be sober? Do they have to do all of these other things? And so all of these things lead to scores. And so based on this, the lowest average scores were related to the services. And so we're working with each of the projects now to talk about what improving those outcomes might look like, and offering the support that we need to. So are there any questions about the Housing First evaluation? Because the next couple of slides will be around the COC performance.
All right, floor is open for questions. Oh, there we go. Eliza, you've got a question.
Yeah, could you just say like a little bit more about what technical assistance looks like?
Yes. So it's vast and varied, and always depends on where the organization is. So we're meeting with everybody. We are providing assistance, for example, in this particular case, talking to projects about how to improve the services that they're offering the clients. We're talking about linkages that they can make. We are talking about connections to community services. And if they, because a lot of times the providers don't have the capacity to hire staff that will focus on employment or that will focus on education and volunteer opportunities. So we're talking to them about what it looks like to partner with other groups. And then, of course, this is regarding Housing First, right? There's the other side where we talk about the performance and what that looks like. So the technical assistance is vast and varied. Technical assistance covers everything from how projects submit invoices in a timely manner to how we can brainstorm with them to see if there are things that they can do better on behalf of the clients. So it's really a vast and varied approach, and each project is fairly unique.
Yeah, that's really helpful. Thank you. And it sounds like supporting capacity of organizations and working together. So I appreciate it.
Yes. Thank you.
Other questions? Oh, I'm sorry, Anthony, go ahead.
No.
And I just want to remind the group as well that the Housing First evaluation it's done for a couple of reasons. One is that there is an opportunity for programs to get a little bit of feedback and to take a look at how we're doing with Housing First. So we have the educational component, our own learning and reflective component there, and then the other piece is that as part of the collaborative application process that Anthony's going to talk about later, we've got to have a Housing First evaluation piece of that. And so this is also going to be in support of that work as well.
Yes, thank you. You guys probably saw my screen went a little wacky and now I can't see any of you, but I'm just going to keep going and trust that you can still see the screen. All right, so when we talk about the approach to the spring performance evaluation, this was a pretty big deal for us. The lead agency staff performs these, unlike the Housing First, where we get teams of folks together. And this year, unlike in the past, we worked with NCCEH to automate many of the components of the tool. This helped to save a lot of time and reduce the likelihood of manual human errors in the process. But it doesn't mean it was without its flaws. And so we are having to work with some of the projects who weighed in on the scores that they received where they thought there might be errors. And so we are having to go back and look at those, and we'll be working with NCCEH and the projects next week to make sure that the results are fair and accurate. And again, just like the Housing First, after the evaluations, we hold feedback sessions with the project providers. So the results of the spring performance evaluations is that we reviewed 8 programs. That's unlike the previous one where there were 9 reviewed because one of them is fairly new and wouldn't get a review this soon. We reviewed 5 PSH and 3 RRH. The average score was about 65% out of 100. There was one outlier that scored at 25%. The remaining projects scored in range of 64 to 94%. The PSH, lowest average scores and most room for improvement, dealt with performance and utilization. And I can say a little bit more about what those are if the committee would like. And then the rapid rehousing, lowest average scores and most room for improvement, dealt with utilization and HMIS. So there are some projects, for example, that the length of stay is too long between the transition into housing or some version of that. And so therefore it has kind of like a ding. And then the utilization is around the cost per unit and how much it's costing to operate the program given the number of units that are available. So there are specific figures that deal with utilization around how many units are available, how many people moved out, how much was spent, and then you develop like an average cost per client. And Colin, if it sounds like I'm struggling, I might be a little bit, but you can jump in if you need to correct anything there. And what happens is we look at the average score, the average cost per client, and score that with what HUD thinks the average cost should be. And obviously, if our costs or our project costs are much higher, then it's a ding, or you don't score as high. Whereas if we come in sort of under the threshold where HUD says we should be spending, then we get extra points. So like I said a moment ago, the lead agency is reevaluating the scores. There have been discrepancies with providers. I will say the discrepancies have not been major, thankfully. So I'm guessing that we'll be able to resolve this pretty quickly. And then we'll continue providing assistance to the projects to improve the outcomes. So I actually cannot see any of you, so I don't know if anybody has questions that they'd like to
Questions for Anthony on this?
Hi, Anthony. Thank you. This is really informative. When you indicated there were some discrepancies by the lead agencies, what, for example?
Well, the tool, so this particular evaluation tool relies a lot on information that comes out of HMIS.
Mm-hmm.
And HMIS is not an easy system to kind of work into, and you have to pull a lot of information out and then move it to spreadsheets and kind of do your magic in the spreadsheet to make it all make sense. So it's not a very easy one click of a button sort of solution. But what we were trying to do is make sure that the process wasn't completely manual as it has been in years past.
Okay.
And so just to give you an idea, the manual process would tend to take about an hour to 2 hours for each evaluation. And it's like taking a test in school. For every question, you've got to come up with the denominator and the numerator, and you've got to figure out the bonus points. And the bonus points, you get 1 bonus point percentage for every 5-point increase from the previous year, right? So when you start manually doing all of those calculations, it's very easy to make errors. And also, there's a slight difference in how PSH versus RRH is rated, even though they're on the same tool. So some questions will apply to PSH versus others will apply to RRH, and some questions apply to all. So again, very easy to make mistakes. So what we did was we worked with NCCEH to take Lloyd's very detailed instructions for calculating the scores and automate that process by downloading the information from HMIS and then putting it in another platform like a spreadsheet. And then we looked at all of those to make sure they lined up. We tested a couple of them ourselves, so we still went through the manual process for 2 or 3 of the projects. When Lloyd was satisfied with the answers, then we just sort of completed the evaluations. So it actually was a great idea for all the projects got the evaluation tool in advance, and they also understand how the scores were made. So it was quite helpful for a project to decide to do its, basically self-evaluate, because it helps compare answers to what we have gotten.
Mm-hmm.
And so that's what the discrepancies look like now, where we might have scored, let's say a 60%, but an agency is saying, oh, we probably should have 67%.
Okay.
And so we just want to go and take a look at those and make sure that we resolve anything with the tool that is maybe inaccurate, because if it's inaccurate for one, it may be inaccurate for others. So we want to make sure that it works for everyone.
Okay, thank you so much.
Mhm. Any other questions around the COC performance?
Anthony, I was wondering if you could also speak to a little bit about the technical assistance you all are providing in regard to, the results that you've seen right now. Now, I know we've got some scores where there's discrepancies and that's got to be worked out, but tell us a little bit more about that.
Yeah, so this one is a little more challenging because the scoring tool is very specific, right? So it doesn't leave a lot to interpretation, right? Because most of it's coming out of HMIS. And so this is in stark contrast to, let's say, the Housing First evaluation, where teams of people went out, they did read a report, but they also interviewed the agency and they also looked at policies and procedures. So the performance evaluation doesn't do any of that. We do look at the reports, but it all comes out of HMIS for the most part. And so this is very specific. So for example, one of the things that we can do, since we know that utilization is an issue, is we can work with organizations to understand how that utilization is calculated. And one big thing I think, Jonathan, that will help is that one of the projects told us, oh, now that we see how this is done, we can monitor ourselves on a quarterly basis, right? So those kinds of conversations, so that the projects really know what we're looking at, how we're looking at it, and also with, for example, the HMIS. There are quality and timeliness standards. There are length of stay type issues in these evaluations. So we can work with the projects to understand what that looks like, and to also understand, and this is probably a much bigger conversation, because this is one where sort of the team, Jeffrey and Colin and others, have been involved, where there are some changes that we need to make to the system. I think, Jonathan, we talked about this yesterday, where for a while, the way we were operating the system was maybe burdening the system in some ways with the most high needs clients. And when you burden the system with only high needs clients, everything sort of gets stuck, and it affects a lot of different areas up to and including performance, and would affect your results in an evaluation like this one. So we are looking at providing some relief to the system, looking at, we've been looking at issues of prioritization. Now I think Jeffrey's working with Nicole Lamb at Entry Point to work on, it feels so weird to talking to you all and I can't see anybody. It's like I'm just talking to my icons on the screen. But Jeffrey's working with Nicole Lamb to look at prioritization and Entry Point and improving that process, so that it unburdens the system in ways that are going to lift, we believe, the load for everybody. So part of the TA is understanding the challenges that the projects have had trying to meet these evaluation components. For example, one project told us that they have to sometimes decide, do we tackle problem A or do we tackle problem B? And whichever one we tackle, it's going to benefit in one area and hurt in another area. So which area would you rather us hurt in, right? And so we're trying to work through those kinds of questions and situations so that we have a full understanding and that we can provide whatever assistance we can to them. So I hope that helps a little bit. It probably sounded a lot more vague than I intended it to, but yeah, I hope that helps. And Colin, Jeffrey, please jump in if
And I would just love to add one other thing here before we move on to another topic. So, inevitably, what always, comes up is if we do have projects that score under the current threshold, which is still 65%, there is always that question of, do we want to do any sort of, or at least consider a performance improvement plan? And Anthony and I discussed this at length, and it is, our recommendation to the committee that we not do that at this time for a couple reasons. One is that we do have some discrepancy with the scores, and that really wouldn't be fair to any projects. But the other thing is that Anthony and his colleagues are also doing some technical assistance behind the scenes to address some of this, and I think that is, that may in fact be more effective at this time than looking at a performance improvement plan. But as chair, I certainly wanted to go ahead and address that, because that always is something that we have to consider as a committee. So unless anyone feels differently on the committee and wants to consider that, then that would be our recommendation. I see Jeffrey, you've got your hand up. Go ahead.
First, let me say that was an excellent job, and Anthony did a wonderful job explaining it. And Jonathan, you kind of broke it down into some really some plain terms so that they could understand. If I could give an example that Anthony touched on, is the prioritization. When the way the system was prioritized before, as Anthony mentioned, was you take in the highest needs clients, and the system was designed to pretty much only take in the highest need clients. The issue with that being is that rapid rehousing is not designed nor intended for the highest need client. Rapid rehousing is light touch. These are households that we should be able to provide some minimal assistance, some minimal case management, and launch these households without them having to have anything further from us. Right now, that has not been happening. We have households that really should be in PSH, or actually some that we don't have some things for, that because they may not have the chronicity yet. What we're working to do, and I know Anthony mentioned Nicole, but also Families Moving Forward, and also Urban Ministries as well, is looking at the prioritization so that we are still prioritizing high needs client, but not exclusively. So we're also getting some people who come to the system and complain that they never get chosen, never get picked, can never get in shelter because they don't have the highest need, although they still have need. So what we're looking to develop is a two-tier approach to entry into our system, where we're looking at what rapid rehousing says, and that is light touch, so that we're prioritizing them as well, but also still having the separate track for PSH. That would not change for PSH. They're still going to be the highest need clients because that's how it is designed. But our movement into a tiered approach is so that we can work with rapid rehousing in a way that it should be worked with as well. That by default is also going to actually help both programs. It'll help PSH and it'll help rapid rehousing as well. So we're going to be going out. We've already started it, doing the TA. We're going out to every provider, and we've already first done the listening sessions. I think 1 or 2 remaining, where we're listening first what the agencies want, and then we're going to go out and we'll tailor it to address some of the things that we've seen. So our goal for a system is that when each agency does well, it benefits the entire system. When these numbers look good, it's good for all of us and for our ability to attract more funding. Thank you.
Thank you, Jeffrey. Any other questions or comments on this item? All right, Anthony, if you want to continue on.
Yes, sir. So, the unspent funds topic was one that I had to really try to understand. And so I made the most elementary chart for myself possible. So I hope that it helps others on this call to understand it as well. Essentially, I have put together over the last 3 years a summary of how funds have gone unspent across projects. And so for each row in this table, you'll see the year, the number of contracts, the number of organizations. And so because you see 4 contracts and 3 organizations, that would mean that one organization probably has 2 contracts. The total value of the dollars awarded in that year, and then how much went unspent, the percentage that was unspent, and the current status over those funds. So, sorry, you can see that for 2021, 2022, we had about 15% dollars unspent, and those funds have expired. So it is highly unlikely that any of those funds will be used at this point. For 2022 to 2023, we had 8 contracts, 5 organizations, 1.3 million in dollars awarded, nearly 500,000 in unspent, which is about a third. I will say, if you look at the notes below, one organization represents about 60% of those unspent funds. So they have had some issues with drawdowns from HUD, and we are hopeful that they will be able to resolve those and go in and reclaim some of the funds that they've spent. So this could change in the next report that you all get to where that number would be, the number unspent would be less. And then for 2023, 2024, this may be the most misleading in the way it's presented, because it looks like 72% is unspent. However, most of that goes through December of this year. So there are 2 to 3 more quarters, actually 3 more quarters in this calendar year where a lot of this money will be spent. So the end process is really nothing to worry about at this point, and we will be able to provide quarterly updates from here to monitor how we're doing. And then our goal is to work with the organization in the 2022 line that has the bulk of the unspent funds to try to help get some resolve between them and HUD to make sure that they can draw down some of their funds. Any questions about this?
Floor is open for questions. So I will go ahead and jump in here as chair and just let the committee know that, and I see your hand. Actually, go ahead, Renee. We'll go ahead and ask your question or make your comment.
I'm sorry, you probably hear some background noise. I'm at a conference, but I wanted to find out, do we have any policy or any SOP as to what can be done once unspent funds are identified? Are they able to be transitioned to any other programs, or are we just limited to work within the contract that we have to assist that agency to be able to spend those funds? Does that make sense?
Yes. I will ask Colin to jump in if he's still here. I can't see, so I don't know if he's
I'm here.
Okay, perfect.
So great question, Renee. These funds, it's yes and no. So the unspent funds from like the 21, 22 funds, that $119,000 was in contracts with various providers. So each one of those providers could have, during that 12-month period of performance, looking at their spending rates, could have gone back to HUD and could have said, we would like to move money from this line item to this line item to be able to possibly spend it completely. So they may have had, I don't know, I'm making up a number, $100,000 in rental assistance. But because FMRs and the units they were renting and clients paying a portion of the rent, the amount of rent that they needed in rental assistance was only $80,000. So they had a $20,000 gap that they couldn't spend because there wasn't enough rent. So they could have rented another unit and brought somebody in, but you could only do that if you had enough, only if you had enough money and case managers to support an additional household. So if you didn't have enough supportive services, why for 10 people, why would you bring an 11th in? Or you could have taken that $20,000 over to supportive services and done something different there, as long as that was part of the original request. If you would only ask for rental assistance, you couldn't move it somewhere else without having to go through a grant modification process, which there really isn't enough time to do that. So that's one way of fixing it. The other option is these COC awards operate on renewals as the highest priority. So what we do is we look at each renewal project and look at, in the past, has there been money unspent on this renewal project? And if we're seeing money being left unspent for, multiple years, for instance, that's where we have conversations saying, okay, this is why we do part of our performance reports, is going back to that agency saying, hey, looks like you had some unspent money last year. What are you going to do to get it on track this year? What can you do to spend it, to do it, to get your draws down? If the agency is unable to make those draws, then we as the lead agency have conversations with those agencies and say, hey, maybe this grant is too much money for you to manage right now. So would you be willing to give up the $20,000 that has been on average not spent over the last 3 years? And then we could take that $20,000 as part of what HUD calls a reallocation. And that $20,000 would be part of the new continuum of care application that would happen in that particular year. And an existing organization would be able to say, hey, we'll apply for that $20,000 and we will put it into our project that we already have $200,000 in, but hey, that's extra 10% would allow us enough money that we could serve X number of additional people in that program. If there's enough money, a whole new program could start. So an example of this is Durham Crisis Response Center. They were struggling to spend and struggling with a few things, and they elected to say, you know what, this is too much for us to take on right now. So they said, we're not spending it all. We're going to give up the whole thing. So we reallocated their entire grant, and that entire amount of money went out for competition and was awarded to a new agency to begin a new project to continue to keep the money. So our goal is to move it if groups can't spend it and they're willing to move it. If the agency is unwilling to move it, performance management, policy and planning, and the HSAC ultimately have the authority, ultimately the continuum of care and the lead agency have the ultimate authority of, how to say it, basically mandating the money being reallocated. So if an agency doesn't want to give it up, they don't have final say. It's really the continuum of care is the one who has to recommend things. So so far we have never ever had to pull that string. Usually it's when money's been reallocated, it's kind of been a mutual decision that it's really not, it's not working for anybody. and other jurisdictions where I've worked in the past, agencies will voluntarily give up a few $1,000s here or there just because they're realizing that they spend more time reallocating money out of a line item somewhere else during the year, and it's just not worth the headache of having to go to HUD, get the budget line items moved, restructuring, and doing that. So does that answer your question? I know it's a lot of information, and there's a lot of if-thens and ways of handling it.
Yeah, thank you so much.
You got it.
Other questions? So I did want to say one thing as chair. Going back that we had this meeting in March where we addressed this topic, certainly as chair, I did sense a lot of anxiety from the projects about, the possibility of reallocation. And, having talked with, Anthony, what is going on right now is there is efforts to provide more technical assistance. And should we have to approach a conversation about reallocation, then it's likely not to be a surprise. It's likely to have been discussed, and as Colin said, oftentimes it's a decision that the project has come to, on their own in conversation with the lead agency, the community development department. So what Anthony and I are recommending to the committee is that we look at spin downs quarterly so that the committee can be apprised, and that way we can also hear back about what technical assistance is being provided, what are the issues, and we can more monitor that, I think, a little easier as the performance management committee. So I just wanted to add that as well. And if there are no further go ahead, Tracy.
I'm sorry, I was running a little late from another appointment. But just wanted to ask a question around, and I'm not sure if based on the last meeting we had with the agencies, is that the city is recognizing that over the years, HUD has tried to increase the amounts to offset the cost of the housing market. The Durham area includes Durham and Orange County as a part of this MSA area. And so they're taking into account the fair market rate rents for both counties, which if you drill down to some of the actual census tracts, there are some parts that are more affordable than others. And I'm just wondering whether or not that was taken in consideration, as a lot of times with renewal grants, you're not asking for any additional money. However, HUD is anticipating the fluctuations in the market to offset the cost of housing and thus giving you more money every year. I just want that to be clear for individuals who are part of organizations that are managing permanent supportive housing or rapid rehousing programs, or those on the peripheral. We're not asking for additional monies, but monies are being allocated to offset that cost. However, what also in that same vein, most of the individuals that we're working with who were chronically homeless are already in subsidized housing, which means it's below the fair market rate rent. You might be serving more individuals like our organization, but you're paying less because the cost of that housing is less compared to the actual fair market rate rents. And so I'm just wondering whether or not that was a part of the earlier discussion, or if that was taken in consideration as we kind of shift to this conversation, because I totally understand in terms of leaving money on the table. I don't think any organization intends to leave money on the table. However, oftentimes this is kind of the scenarios we're kind of working within.
Mm-hmm.
And Tracy, you're absolutely right. That is one of the reasons money gets left, because sometimes that fair market rate increase that HUD does becomes a challenge, especially if you are fortunate enough to find units that are below FMR. It's not easy, but it's a blessing and a curse when you find units that are below FMR. And it's also a blessing and a curse when participants in the program are able to pay a significant or even any amount of money towards that leasing cost. So, you know, it's one of those things that as agencies look at their budgets, thinking through what does the FMR look like? Could we bring on another unit? Could we reallocate this? So it's a way of working through the budget in different ways. And it's, you know, and the increase isn't usually $15,000 or $20,000. It's, you know, a moderate, you know, chunk of money depending on how many units and how big your contract is. And I found the rhyme and reason to how HUD does the math to figure it out, and it's a really convoluted equation on how they calculate that next year FMR increase. It's not like, oh, you asked for 3 one-bedroom units and here's the new FMR, so here's the difference between those. It's a really convoluted mathematical equation that they use that makes it hard to manage. But yeah, that is one of the big reasons why money is left, is because of that unrequested bump in FMR that they give.
I do have a question along those lines too. For my own, you know, knowledge here, can our projects, I mean, if they ask for a certain amount and HUD gives them a little more, you know, for whatever reason, maybe it's due to this FMR increase, do our projects have the right to refuse that additional funds, or is it just given regardless?
It's given regardless. It's kind of an automatic adjustment that HUD does in order to ensure that you have enough money to cover rents for the projects that you've said you're doing. There was a time way back in the day that it was like literally flat funding and they wouldn't bump things. And then it became a problem because people couldn't rent and didn't have enough match money to do it. So they've kind of had to do it. It's kind of like a cost of living adjustment that would happen in a paycheck. You can't really say, I don't want it, even though it might bump you into a new tax bracket and you end up taking home less money. It's kind of like, you're going to get it whether you want it or not. So yeah, it's the way you can take it without taking it is being able to know it's coming and reallocating it, but you have to know it's coming and make sure that you set your contract up at the beginning and your plans for the money to reallocate money and line items. There's a way to do it and plan for it, but making sure that you've got money in leasing or rental assistance and operations, or rental assistance and supportive services, so you can move money between whatever line items are originally in your contracts and your application, because that's what all the funding's based on.
Thank you, Colin. Any other questions or comments on this item? All right, back to you, Anthony.
All right, so this is our last slide. And this just talks a little bit about where we are in the 2024 collaborative application process. We have reviewed the 2023 scores, and we have also requested a full debrief from HUD. We have followed up. We are still waiting on HUD to either send us the full debrief document or schedule a time for a call. My guess is that they'll send the full debrief document, but we have not received it yet. We have registered as the lead agency for the 2024 competition. We will be reviewing the grant information worksheets this month, and also starting a pre-application process that will go between this month and the end of June. We will form the review committee and meetings to kick off in June this year versus July, as it was done last year. I believe that we will have a few more weeks in the process to really hunker down and submit a stronger application. And I don't know if everybody on this call knows, but we did get higher scores in 3 of 4 sections on the collaborative application. before for this year. We still had challenges in some areas, and we are working on those, but we did go up a little bit from last year, so we're hoping to continue that trend. Our performance evaluations for the fall will occur in August, and it's at that time that we will do the prioritization for the collaborative application. And of course, HSAC must approve the final application to be submitted. The application is typically due at the end of September or early October. It varies from year to year. So we don't have any of that information yet, but we will keep you posted as it comes available. Any questions on the collaborative application process for this year?
All right, go ahead, Tracy.
Excuse me, just a quick question. So the pre-application process, you said between May and June, has that started yet, or have you all sent out any information regarding that yet?
Not yet, but hopefully very soon. We had some technical details in Zoom grants that we had to fix, but we're hoping to get it out, I would say within the next couple of weeks.
Okay, so
and let me also say, Tracy, that the pre-application process this year is really for just new organizations who have not been approved or funded prior to last year. So in other words, maybe you were approved for the competition last year, but you didn't get funding. Well, you're already vetted for this competition, so you wouldn't need to do the pre-application again.
Oh, okay. All right. Thank you for that clarification. And also, has HUD indicated when the NOFO will be released? Is it around, or are we anticipating around July?
Yes, that's the typical time. But they have not indicated yet when it is, but we do know we anticipate it around July.
Okay. All right. Thank you.
Other questions, comments? Hey, thank you, Anthony.
Oh, I stopped sharing and you all came back. Hi. All right, very good.
Well, that brings us to the end of our formal agenda. Are there any announcements? Well, if not, I'm sure we could all benefit from a half an hour back of our day. So I am happy to entertain a motion to adjourn.
This is Eliza. I'll make a motion to adjourn.
Eliza Matthew has moved that we adjourn. Do we have a second?
I second.
All right, we have a second from Tracy Stone-Dino. Thank you, everybody, for your questions. Thank you to Anthony for a great presentation, and to the rest of the community development department team. And we'll see everyone at HSAC this month. Have a great day.
Thank you.
Thanks, everybody. Thanks, Anthony.
Bye-bye.